to a local dermatologist, Dr. Sims, and fit me in as an emergency appointment.
When I first met Katie, she was understandably anxious.
I told her the progression of things.
What was interesting about it was the number of blisters that she had. And she had lots of patches of pink inflamed skin. Mostly these were on her arms and her legs. And sometimes the blisters actually formed a very symmetrical pattern that suggests that this is something coming from the inside of the body. The most important test was to do a biopsy. So I biopsied a tiny blister on her thigh.
When she did that, I was extremely hopeful because no one had made a step like that before. You know, they were actually testing my skin.
It takes usually about 6 to 7 days to get a biopsy report back.
At first, Katie is determined to get through the long wait by herself. But after a few days, the uncertainty becomes unbearable.
She called us at the point where she was getting panicked. My fears were that she had something really bad and that we should probably have her drop out of school and come back home.
At that point, I talked to Katie's mom. She was very anxious about her daughter being several hours from home and her not being able to be there.
It was tough waiting for the results, but at the same time, I was afraid that it would have been some disease that there wasn't a cure for.
After an anxious week, the lab report finally arrives on Dr. Sem's desk. And it doesn't take long for her to zero in on the source of Katie's problem.
What really clinched the diagnosis in Katie's case was a test that showed that there were antibodies were on the roof of the blister. With all that information, the only diagnosis that she could have would be bullous pemfigoid.
Bullous pemfigoid is an autoimmune disorder of the skin. In a healthy individual, antibodies help guard the body against infections and foreign substances. But in patients like Katie, for some unknown reason, they attack the tissue that joins the top and middle layers of the skin, weakening and separating them. The result is severe inflammation and blistering.
The epidermis, our top layer of skin, is attached to our dermis, the second layer of skin, by something called the basement membrane. The basement membrane is basically the place where the glue is that holds the epidermis onto the dermis. And that glue is what gets attacked in bullous pemfigoid. So as the antibodies attack that area, they cause inflammation to occur.
Surprisingly, what Katie thought was the initial symptom, her rash from the TB test, had nothing to do with the condition at all.
When Katie's rash first started, she just had the TB skin test done on her forearm, and I think it was somewhat coincidental.
In fact, the first signs of the disease were the red raised marks that Katie thought were insect bites.
When bullous pemfigoid lesions first start, they're often just pink, swollen, itchy areas, and they can look like a bug bite. So there's often quite a bit of itching because of the inflammation.
And as the inflammation gradually increased, it was only a matter of time before blisters started to form.
When there's inflammation, there's swelling. That swelling is caused by fluid coming to the area. There's increased blood flow to that area, and that increased blood flow basically causes leakage of fluid into the tissues. It causes so much inflammation and swelling that enough fluid collects underneath the skin to force the skin up and into a blister.
I felt great to finally have an answer because I could start getting better, could start getting my normal life back.
But despite her relief to finally have a diagnosis, Katie can't help but wonder why so many other doctors were unable to identify the disease.
If you take 100 patients with blisters, 99% of them are going to not have bullous pemfigoid at least. The majority of people who get bullous pemfigoid are very old. It's not a really common disease. I think I probably see a patient a year maybe with bullous pemfigoid, but about 90% of them are over 80 years old.
How did this happen to an 18-year-old girl?
There's no known trigger to this, and why it manifested in her at such a young age, we really don't know. We don't know what causes bullous pemfigoid. All of the autoimmune blistering disorders are caused by antibodies that the body develops, but we don't know what it is that first starts the body to make those antibodies.
Katie may never know what triggered the disease, but now she and her doctor have more pressing concerns: how to deal with it.
The worst case scenario for bullous pemfigoid is when you get more than 80 or 90% of the body surface area affected. And the biggest problem there is open sores can be at risk for infection, so that those things can actually be quite dangerous and even life-threatening.
Katie desperately needed a solution. She needed to start to get better.
After enduring painful and disfiguring blisters for 2 months straight, Katie Faust has just learned that she's suffering from a rare autoimmune disease that can be deadly.
It made me scared, but at this point, I was just ready to start a treatment plan.
While there is no cure for the disease, it can be treated.
The first thing we did was to put her on oral steroids. These usually work great to suppress the antibody that's triggering the disease.
I just really wanted to know how long I was going to have to live like this. I wanted things to go back to normal so badly.
She actually got quite quick relief, so the blisters started to heal and blisters stopped forming over a week or so. The goal usually over time is to taper down the dose. Many times as we taper therapy, we'll hit a point where all of a sudden blisters will start to form again and we'll have to up the dose again. So many times we'll add on another medication to suppress the immune system that then allows us to get to lower doses of the steroids over time.
The combination of the immunosuppressant and the steroid eventually got rid of everything altogether.
Katie was able to get off of her medications at 14 months after we diagnosed her.
But while the treatment is successful, Katie will have to remain on guard for the rest of her life.
It is possible for her to have some recurrences here and there. You really don't know if she's going to have recurrence until you see a blister.
Buloz pemphigoid is a chronic condition, so I will have to deal with flare-ups for the rest of my life, but nothing will be as bad as the first time because they know what it is now and because they know the medicine that works for me.
Today, Katie is healthy and on track to fulfill her dream of running her own restaurant one day.
Last December, I graduated from college with my Bachelor of Science degree in business management. I am currently working at a fine dining restaurant in Columbia, Maryland.
Katie is great now. She is 100% back to herself, 110%.
The diagnosis has definitely taught me not to take my good health for granted.
I didn't understand how it couldn't leave scars, but it didn't. She has great skin now. She's got a great life ahead of her, and she's off to a great start.
I'm just thankful for having confidence again. I'm no longer worried about what people think of me. I have my life back.
While Katie Faust searched desperately for answers to her mysterious condition, Angela Badgley simply tried as best she could to live with her symptoms until the dangerous disease began to spiral out of control. In 1977, 12-year-old Angela Badgley was enjoying a seemingly ordinary childhood in an Indianapolis suburb. Although her mother, Evelyn, a music teacher, was raising Angela and her sister by herself, the Badgley household was without a doubt a happy one.
I was a very active child. I rode my bike all the time. I was always outside playing with my friends and my sister.
She's always been a sweetheart. Angela worked hard. She was a big help to me because it was not easy with just me and the two girls.
Everything seemed to be, a pretty normal life.
But soon after Angela turns 12, she comes down with a strange sore throat. Although the doctor prescribes a round of antibiotics, it just won't go away.
Angie had been sick for a couple weeks. She was under doctor's care for strep throat. She kept getting worse and worse. She was losing weight, and I called the doctor on a Friday and told him she was worse. Could he please see her again? And he says, just tell her to tough it out till Monday.
But the very next day, things take an even more shocking turn.
I was vomiting all night long. I was begging her at 12 to take me to the hospital, which isn't normal for a kid to do. Finally, I think I passed out because I don't remember anything from that point on.
I had to pick her up and carry her to the emergency room at the hospital. Right away, they took one look at her and wheeled her off.
I woke up and I was in the emergency room, and there were doctors all around me.
Over the next hour, the medical team runs a battery of tests on everything from Angela's blood pressure to her blood sugar levels.
And her blood sugar was in the 900s. It's supposed to be around 100. That was a nightmare.
And they told my mom I had type 1 diabetes.
Type 1 diabetes, once called juvenile diabetes, is a disease in which a child's body can't make the insulin it needs to turn sugars into energy. As a result, the amount of sugar in the blood skyrockets. Treatment is critical to keeping patients alive and well.
We had to go to classes to learn how to take care of her, how to feed her, how to do shots, the whole thing.
I was still a very active kid and very healthy.
She was always very brave. Life is not always fair. This happens. But she's tough. She handled it.
You know, I kind of came to grips with it and accepted that.
In fact, Angela copes so well with diabetes, it isn't long before she becomes inspired to help others. And by the time she graduates from high school, her career path is clear.
I went to nursing school for 4 years and became an RN.
Nursing is Angela's sole passion. That is until the summer of 1990 when she meets stockbroker David Smith.
My sister kind of blindsided me one day. She says, hey, you know, I know this girl that you really get along with, and we just got along great together.
And neither one of us has dated anyone since then. We got married a little over a year later. David and I got married August the 3rd, 1991. After being married about a year, I started, you know, just having these feelings like I really wanted to try to have a child. And so I got pregnant. Through the pregnancy, I was fine.
And on a beautiful Easter Sunday in 1993, Angela and David welcome a daughter into their family.
Sarah was just perfect. We were very happy.
I just couldn't believe it. I just wanted to hold her.
As Sarah grows into a preschooler, Angela balances motherhood and nursing with ease. But then, one morning in the winter of 1996, she begins to notice a strange sensation in her lower back.
It was like a gradual thing where I started having back pains. Kind of what felt like little minor back spasms, but I just thought, you know, I had hurt my back at work.
I knew that one of her duties was to assist her patients. She'd have to lift them up to go to the restroom or roll them over to change the sheets.
At first, Angela dismisses the pains, but over the next 3 months, the spasms steadily escalate.
As her back pain got worse and she started to really have trouble bending over, I would have to help her get ready in the morning.
David would sometimes have to put my shoes on me because I couldn't do it. I tried some over-the-counter pain relievers, but nothing even touched the pain, nothing helped at all. I was starting to have some worries that something might be wrong, but I just kept thinking, I'll get better. It'll go away.
In fact, Angela is confident that if she strengthens her back muscles, she'll feel like her old self. And that March, David gives her a bicycle for her birthday.
I just really thought I was out of shape because I had always worked out, and, you know, after having a baby, I really wanted to get back into shape.
Her bike, I thought, was a wonderful idea, but she just couldn't do it. I'd have to hold on to the seat, kind of run with her a little bit and get her started.
Once I got started, I could go for a little while, but then I couldn't stop. It was weird because I got on the bike and I had no balance. I kept falling. I couldn't ride the bike. I couldn't stop the bike, and I just fell into the grass.
And it wasn't until she fell in the grass that was, you know, the sign that, you know, it's just not going to happen. I thought, okay, we need to stop.
My first thought when I couldn't ride the bike was that, you know, I'm just really out of shape, totally out of shape. It was shocking, but yet I still thought I was out of shape. And I didn't want to worry about anything else.
Over the next 6 months, Angela does her best to simply live with the spasms and pain which seem to kick in at random. But one afternoon in October, without any warning, her ordinary life turns into a living nightmare.
My mom was a teacher, and the school that she worked at, they always had a Halloween parade. And Sarah wanted to be in it. It was kind of a cool day. I was just walking along with my mom, and we were just talking, and the kids, they were just marching along, and all of a sudden, my back, I just felt something